5 medication classes with 3 of the best for diabetes. Metformin, SGLT2 inhibitors, GLP-1 agonists, DPP-4 inhibitors, and sulfonylureas are all common medicines for type 2 diabetes. But they each have their own good points, bad points, and very different prices. Let us start with SGLT2 inhibitors, like Farxiga, Jardiance, and Invokana. These medicines help the kidneys pass extra sugar out in the urine, so blood sugar can drop by about 0.5 to 1.0 points in HbA1c for many people. They also have powerful benefits for the heart and kidneys, cutting the risk of kidney disease getting worse by about 30 to 40%, and lowering hospital stays for heart failure by about 1/4 to 1/3. But they can cause more urine, thirst, and genital infections, and there is a small risk of ketoacidosis even when blood sugar is not very high, so people must know the warning signs. There is also a rare risk of severe genital infections and volume loss, so older people or those on water tablets need close care. Limiting simple carbohydrates and refined sugars may help in preventing urinary tract infections, or UTIs, as these sugars can feed harmful bacteria. I also avoid foods containing more than 70% carbs by dry weight. On the price side, these drugs are among the bit more expensive diabetes tablets, with average monthly costs around $600 in many health systems, although some data show about $50 to $60 out of pocket for insured patients in the United States, depending on their plan. Some countries have pushed for price cuts of at least 15% to make them more affordable, but they still cost much more than older drugs. So SGLT2 inhibitors can give strong heart and kidney protection, but the high price and side effects can be a problem for many people. Following are the main SGLT2 inhibitors and their corresponding trade names: empagliflozin, Jardiance, dapagliflozin, Farxiga, US, Farxiga, EU, Australia, canagliflozin, Invokana, ertugliflozin, steglatro, bexagliflozin, Brenzavi, sotagliflozin, Inpefa, ipragliflozin, Suglat, luzeogliflozin, Lucefy, tofogliflozin, Appleway, Deberza. While we are in the middle of the video, click the like button and subscribe to my channel. It is a simple help to me encouraged to make more videos. Thanks. Now let us talk about GLP-1 agonists like Ozempic, Victoza, and Trulicity. These medicines copy a natural gut hormone and help the body release more insulin when sugar is high, slow the stomach, and reduce hunger. So HbA1c can drop by about 1 to 1.5 points, and people often lose 10 to 15% of their body weight, with some newer ones showing up to 20% weight loss at higher doses. They also lower blood pressure and improve cholesterol, which is good for the heart. But they often cause nausea, vomiting, diarrhea, or constipation, especially when starting or when doses go up, and some people feel tired, dizzy, or have headaches. There are rare but serious risks like pancreatitis, gallbladder problems, possible kidney injury, and thyroid C-cell changes in animal research, so people with certain thyroid or pancreas problems may need other choices. Another issue is that weight often comes back after stopping, and many people may need long-term or even lifelong treatment to keep the benefits. The price is also a big barrier, with many reports of monthly costs in the range of $800 to $1,200, and even discount programs often only cut this to around $500 a month. So, GLP-1 agonists can work very well for sugar control and weight loss, but they are costly and can cause stomach side effects, which makes them hard to use for everyone. Next, let us look at DPP-4 inhibitors like sitagliptin, or Januvia, saxagliptin, or Onglyza, linagliptin, or Tradjenta, and allogliptin, or Nesina. Common combination products include Janumet, sitagliptin and metformin, and Gentadueto, linagliptin and metformin. These medicines block an enzyme that breaks down natural incretin hormones, So they help the body release more insulin after meals and reduce liver sugar output in a gentle way. They usually lower HbA1c by about 0.5 to 0.8 points, so they are not the strongest, but they are easy to use once a day and do not usually cause weight gain. One of the main good things is that they have a low risk of low blood sugar when used alone or with metformin. But they do not give the same heart and kidney protection seen with SGLT2 inhibitors, and they have not shown the same weight loss as GLP-1 agonists. There have been rare reports of joint pain, pancreatitis, and possible heart failure issues with some drugs in this class, so doctors need to watch for warning signs. In terms of price, DPP-4 inhibitors used to be expensive, but in some places there have been price cuts of at least 15%. And as generics appear, the monthly cost is moving down toward the low hundreds of dollars or less. They are still more costly than metformin or sulfonylureas, but cheaper than most GLP-1 or SGLT2 drugs in many health systems. So DPP-4 inhibitors offer a middle path, with modest sugar control, low hypoglycemia risk, and moderate price, but not the strongest heart or kidney benefits. Now we will talk about sulfonylureas like glipizide, glyclazide, and glyburide. These are older medicines that have been used for many years, and they work by making the pancreas release more insulin all day. They can lower HbA1c by about 1 to 1.5 points, which is strong, and they are usually taken as cheap generic tablets. In many countries, a month of glipizide or glimepiride can cost less than $10 to $20, and they are often on low-cost pharmacy lists. But the big problem is low blood sugar, especially with drugs like glyburide that stay in the body longer. Some research shows people on glyburide have about 50% higher risk of hypoglycemia compared to other insulin-releasing pills and about 80% higher risk compared to other sulfonylureas. This risk is even higher in older people and in those with kidney disease. So many experts now prefer glipizide or glimepiride instead of glyburide. Sulfonylureas can also cause weight gain and may stop working as well over time as the pancreas gets tired. So they are cheap and strong, but they carry a real risk of low sugar and weight gain, which can be dangerous for some people. Finally, let us talk about metformin. Metformin is usually the first tablet for type 2 diabetes in many guidelines because it can lower HbA1c by about 1 to 1.5 points, does not usually cause weight gain, and may even help with some weight loss. It also seems to lower the risk of heart problems over time in many people with diabetes. The most common side effects are stomach problems like nausea, diarrhea, and a funny taste in the mouth, especially when starting or when the dose increases. But these often get better when the dose is raised slowly, or when people use an extended release form. A key long-term issue is vitamin B12 deficiency, which has been seen more often in people who take metformin for many years, and this can lead to anemia or nerve problems if not checked. There is also a very rare but serious risk called lactic acidosis, especially in people with severe kidney disease, heavy alcohol use, or serious heart failure, so doctors usually avoid high doses in these groups. On the good side, metformin is one of the cheapest diabetes medicines, with many places offering a month's supply for under $4 to $10 as a generic. So metformin is often the backbone medicine, with strong sugar control, low cost, and a long safety record. But it still needs monitoring for stomach issues and vitamin B12 levels. Putting all this together, you can see a pattern. Newer drugs like SGLT2 inhibitors and GLP-1 agonists often give extra benefits for the heart, kidneys, and weight, but they cost much more and can have special side effects. However, SGLT2 medications have come down in cost considerably, and some generic versions are available at affordable prices in most countries. Older drugs like metformin and sulfonylureas are cheap and can lower sugar well, but metformin can cause stomach issues and vitamin B12 problems, while sulfonylureas bring a real risk of low sugar and weight gain. DPP-4 inhibitors sit in the middle, with gentle sugar control, low hypoglycemia risk, and a price that is between the very cheap and the very expensive options. But the best choice is always personal, based on age, kidney function, weight goals, heart risk, and what someone can afford. I hope you have learned some valuable information. If you can click the like button and subscribe to my channel. It is a simple help to me, encouraged to make more videos. Always talk to your healthcare provider before changing medication. This video is not personal medical advice. Thanks.